disorder. A lot of it was came from my childhood. I had a very traumatic childhood, abuse, neglect, unfortunately, a lot of sexual abuse, things that played a huge role in my overall mental health, and it did not do me any good. It did a lot of damage, especially when it came to processing emotions, dealing with relationships, being able to manage my life. Overall, it did affect me in a lot of negative ways, and it started to really rear its ugly head into my late 20s, early 30s. It also led to some substance abuse because of the fact that I was trying to cope and deal with a lot of things that were unresolved. And so I had been prescribed medication about 7 years ago, but I did not start my medication until a year ago, a little over a year ago. So now I have been on medication, which is Lexapro or escitalopram. It's hard to say, but it the generic brand name is Lexapro. So my doctor started me on that one, and I started off at 2.5 milligrams, and now I am at 20 milligrams. Over the course of time, I had to up my doses. That was recognized when I noticed I wasn't feeling well. So to start you off, I started my medication in September of 2024, which it was really hard for me to decide to go ahead and do that because I was very overwhelmed by the amount of information that was out there, and a lot of people did have some scary things to say. I decided to take the risk. I talked to my doctor. I expressed the risk that I was concerned about. He assured me that symptoms are very minimal and that they will watch for anything that may be alarming, and thankfully nothing was alarming. I'll tell you that now. There was nothing that has happened that has been that to that point at all. Now, I did have regular symptoms that are expected in the very beginning, and so that is what I want to start off with today, is talking about how the medication affected me in the beginning, and that will start the topic of discussion on medication along with mental health and how it is working for me. Now, this is ASMR, so I will be whispering and making just some tapping and some relaxing noises, so please keep that in mind. If you're not an ASMR person, then I'm sorry. We could definitely chat in the comments, though, and I do appreciate you being here. Either way, it is a great support to me. Now, getting right into it, I decided to log all of my symptoms so that I can remember, because one of the symptoms with Lexapro or any type of antidepressant is going to be some cognitive issues, as far as remembering things, kind of getting tripped up on your words, a little brain fog. All of that is normal, but on top of that, I already have a hard time remembering things, so I did make sure to log it, and so I'm going to be looking at my notes to make sure I'm sharing everything with you guys for the first few weeks anxious. I had some nausea. I was using the restroom more. Number two, a bit woozy, foggy in my mind, yawning, and feeling tired but not sleepy. I felt lighter in my thoughts and emotions, and I did have a hard time falling asleep that night, which is not like me. A day two, it was a bit woozy, and not as much as the day before. I felt euphoric. I did have a few anxious moments, but I did feel happier, and I yawned a lot. That was on day two. Day three, I felt tired and relaxed. I woke up at 4 a.m., anxious and fearful. I almost can remember that now that I'm reading it, but I do remember just waking up like, oh my god, everything felt so intense. On day four, I felt heavy waves of anxiety, short of breath, tingly sensation in my head. On the left side, I felt a little foggy, but they were all manageable symptoms, I wrote. Day five, I was going to quit, but I was going to quit it. I had a bad irrational reaction to my son's puppy smelling up the room, so I decided to continue taking it. I just didn't like the way I was acting, so yeah, so I went on ahead and took it later in the day after I realized, yeah, I need help. Day six, not very many symptoms. I did go down to 5 milligrams. I'm wondering, I think that was because I told my doctor I was getting anxious and they put me down some, so. Alright, so last day of the week, day 7 was September 11th. I felt a bit tired, but it could have been for other reasons. Seems to help that I take it at night. I didn't feel as stressed out as I normally do. Like normally, I put here that I missed an important meeting, and normally I would freak out, and that would just cause a spiral, but I remember I handled that with ease, a lot better than I would have normally handled that. So I do have documentation of all the other days all the way through a month after taking it, and I do just kind of talk about some of the things that I dealt with during that time. So I will definitely continue this if there's an interest, or if there's anybody out there that wants to know more, just let me know in the comments so I know what to address on my next video. But so far I'm still on it, and I have seen a huge improvement. Now, not all medications are going to work at their best at all times. There are like adjustments, and there are some times where you're not going to like how you feel. I didn't like how I felt recently. I do feel like I'm kind of numbing out. What's what they call it, where I don't feel as much as like I want to feel. Like if I'm supposed to feel happy, I don't really feel as happy as I know I felt before in those situations. Or if I want to like express excitement, I just don't really feel it. I have to like force it sometimes. So those things I have to address with my doctor. I don't currently have a doctor right now, so I'm kind of just like taking it as I can, as best as I can, and I am looking into like different things about this medication when it goes into the long-term